Good afternoon, everyone, and thank you for joining us for this week's episode of United Way Unwrapped. My name is Allyson Cobb, and I am your host for this Friday's episode, where we are delighted to have two of our awesome funded partners here with us today to talk about COVID 19, the response and recovery this year, and how organizations have pivoted to support community during a pandemic. Excuse my voice, I am under the little bit of the weather, so if I sound like Kermit the Frog, I apologize, but we're going to press ahead. Here at the United Way of the Greater Triangle, it is our mission to eradicate poverty and increase social mobility through the power of partnerships. And I am truly amazed every week at the awesome partners who show up for us and really help us tell their story about how they make huge impacts in the community. Today, I have two awesome ladies joining us from two great organizations in Wake and Johnston County, and I will give them the opportunity to introduce themselves in a moment. But we're excited to have both Beth Moore, the Family Services Manager for Partnership for Children of Johnston County, and Erika Carey, Senior Director of Operations with Southlight Healthcare. That should say Wake County. My apologies, Erika. Ladies, if you would please unmute yourself at this time, and I would love for you to tell us about your respective organizations, your mission, who you serve here in the Triangle. Whoever would like to go first.
Go ahead, Erika. You should go first.
Okay. I am at Southlight Healthcare. Southlight has actually been around for 50 years, which is pretty hard to believe. I don't think you see that too often. We've worked hard to become a trusted quality service provider. We work with individuals and families who have substance use and mental health treatment needs. We're primarily in the Triangle and the surrounding areas. I don't know if you wanted just to talk a little bit about the services we provide.
Please.
Yeah, so we have adult outpatient. We aim to really provide a healing treatment environment. It includes individual and group therapy, opioid treatment. That's one of our largest programs, psychiatry and medication services. We have a really large community-based program. So we're meeting with individuals in their home and in their communities. And these services are really geared more toward connecting with individuals that are really challenging to engage with. So we're meeting them where they're at, right? And helping them to move through the stages of change. And when we talk about recovery, we're talking about mental health, we're talking about substance use, and a lot of our folks are dually diagnosed. We actually have a family and children services, and one of our major ones is our women and children's residential program. So we work with pregnant women and young mothers, or just women in need, and provide wraparound services for them and their children to help them to be more independent and move towards the meaningful life. And then we really have a robust judicial program as well, where we work with first-time offenders for substance use and provide education and assessment. So we try really hard to have a quality continuum in order to meet the ongoing needs of our clients, regardless of where they are in their treatment, and to just continue to address the needs of the community.
Awesome. Thank you so much for sharing that, Erika. Beth?
Hi, my name is Beth Moore. I'm the Family Services Manager for Partnership for Children of Johnston County. And we serve children and families that have kids 0 to 5. So it's the little ones that we take care of the most. We offer parenting education programs, concrete supports. We offer play groups for families. We offer different types of programs for all different types of families. And it's without regard to income. So we can serve any family as long as they have a child 0 to 5. And we don't care if they make $0 or $1 million, because sometimes parenting is just really hard and everybody needs a little help sometimes. One of the other departments that we have works with early childhood educators to help improve the quality of childcare within our county. So the partnership is actually we serve Johnston County, but the partnerships serve families across the entire state. So there's about 75 different partnerships across the state that do similar things. So we're very excited to be here and share some of the things that we have going on in Johnston County.
Thank you so much, Beth and Erika. Again, it is awesome to hear from our partners and their great representatives who can really talk about why it's so important to support families, community, and all things alike during this time. We know that COVID-19, since the beginning of March for many of us, has really come in and changed the way that we think about communing, society, and all of the ways that we really implement programs as nonprofit organizations. And so today's conversation is to really talk about how both Southlight and Partnership for Children have been able to really pivot during this time and really come up with some creative and innovative ways to continue to meet the need in community. So thank you, ladies. I'm going to turn to Beth first here. We recently have had families to go back to school, some in a virtual capacity, some in person. Most recently, our Governor Roy Cooper, announced on yesterday that school districts would be allowed to return to in person, so they choose given their capacity. And so just thinking about sort of social distancing, where we are this far in the pandemic, I wanted to really focus on the practices that are currently in place and the people, and particularly children, who aren't able to gather traditionally how we have in the past. How has your work been affected by that? And what are some creative and innovative things that you all are doing as an organization to really kind of still have that feel as if you were together, even though we're in a pandemic?
That's been really challenging, Allison, because prior to the pandemic, all of our work was hands-on. We did groups that would have about 15 adults, and then the children would have their groups, which could have upwards of 20 children at a time. And we would have home visiting. We do some programs that are home visiting. Everything was hands-on, even car seat checks, where we have families come in and we give car seat education and install car seats. So when the pandemic hit, and nobody could see each other anymore, we had to really pivot and be nimble and learn Zoom and teach families how to get on Zoom and try to keep them engaged via a screen. So some of the ways we have been able to continue some of our programs via Zoom, which is okay. And the families seem to still be able to connect with each other. We've gotten pretty good at using breakout rooms for small group discussion. But we are really missing that human connection. And I know our families are too. Again, our organization serves children 0 to 5. So they don't understand what social distance means at all. One of the nice things a lot of our childcare facilities that we work with have been able to remain open, and they've put safety measures in place. We were able to help get some cleaning supplies, masks, gloves, stuff out to the childcare centers. And so the children still have had some interaction with each other. We also do a play group online, which has been kind of fun. So they sing little songs and they do some of the things that we would do in person. But I'm really ready for the days that we can all see each other again.
No, definitely. And I think we all are. And I think you pointed out here something that is that stood out to me really, is that the population you serve, 0 to 5, right? That for a lot of them, they're growing up, or their more formative years are happening during a pandemic, right? And so what will be those long-term effects or impacts of really not being able to socialize and not being able to make those connections and build those skills? How will that impact them in the long run? Are those kind of conversations that you guys have at the partnership?
Absolutely. We worry, and we do worry about the trauma that the pandemic has created. We do a lot of work with adverse childhood effects and, how to overcome them. So a lot of our parenting programs are abuse prevention programs. And so what we worry about is, especially with families being home and maybe more vulnerable to abuse and neglect, that we're not able to put our eyes on them necessarily. And the mandated reporters that may be able to help a family get safe aren't seeing them as much either. So we are a lot worried about some of the long-term effects in that way. But we're putting some social emotional stuff in place for families to work on with their children at home. We're focusing a lot on self-care for the grown-ups as well as the children, because if the grown-ups aren't well, then they're not going to be able to necessarily help care for their children as good as they would like to. So we're doing a lot of self-care webinars and meetings with families to teach them how to calm down, how to manage the stress of a global pandemic and possibly loss of jobs, et cetera. So we're really working hard to kind of work on that trauma.
No, I love that you brought up how important self-care is, right? And how making sure that the parent has to be okay for the child to be okay. And that makes me think about the work that you guys do, Erika, at Southlight, and really trying to build in those skills and support clients in your community that come in during this pandemic who are experiencing a traumatic event, right? And providing the support to them. Have you guys seen an increase, Erika, in sort of the request to have sort of access to counseling or mental health resources for adults?
Yeah, we have seen about a 20% increase in demand for our services just through the coronavirus pandemic already.
Yeah.
We're really committed to supporting and meeting the needs, but have to, like you said, be really innovative and creative in what service delivery looks like, because it's similar to the challenges that were just mentioned. We've really had to adjust how we do things in order to meet the increased demand.
No, and I think that's so important, right? That these were in your field of work, Erika, there was already a need. And now these needs have been exacerbated by a pandemic, right? And how do you pivot swiftly, but also remain intentional and impactful to the population and community that you serve? I think that this is something that we're going to be studying for a long time, that there are folks who are going to be saying, what is the overarching impact of this beyond just the immediate response, right? What does that recovery phase begin to look like? So I think that's so important to really highlight and discuss. I want to kind of move us along to really looking at Southlight provided some really great statistics as it relates to their community and who they serve. And so, Erika, I want to give you an opportunity to kind of share or create a picture for us about what these numbers mean.
Sure, absolutely. We want to be intentional about understanding, like, this is all happening so quickly and so unexpectedly, and we want to really be able to look back and capture, like, what did this mean? How did this impact our community? So we've tried to, do some tracking based on, like Beth had mentioned, having to switch to a virtual platform, right? We really didn't have virtual services in place. And now we've shifted and adjusted to where we're not only providing counseling, but intensive group, via the web, via the smartphone or whatever. We've had to be very creative. So people are getting counseling. They're also getting peer support over the phone or over the computer. And so we've served, over 2,000 folks with virtual services. They're seeing their psychiatrist, right? We put in the hours of therapy and med management that have been going in. We joke, but our team members, that most of our folks are working virtually. We do have frontline staff, and I'll talk more about that later. But We feel like we're working so much more now than we ever were before. And we thought
I
we
hear
were.
that.
Yeah. We've had our peer support program. The county had asked us if we could help out with individuals that they were housing in hotels.
Mhm.
And so we've been providing virtual counseling, but we've also been providing peer support services, and we've helped these individuals, and this isn't just this number, but as an example, to try to find long-term housing or meeting basic needs. I mentioned our Women and Children's Residential Program. That is frontline. We've continued that service. We've had to outfit all of the apartments with full telehealth, full computers, phones, because we need to make sure our women and our children continue to receive wraparound services. It's a time-limited service that doesn't change because there's a pandemic. And yeah, just some of the other numbers just between community outreach and judicial services, although they have been cut, we're still, the services continue regardless, right?
Right. Exactly. No, and I think it's so important to highlight how you all were able to grasp that just from May to August and the impact that is there. And when you're able to put numbers behind it and tell that story, I think that helps people to understand the impact and why it's so important that we continue to support programs and organizations such as Southlight and Partnerships for Children to ensure that people are getting the correct support and the right support that they need. I know I read a lot of articles and listen to a lot of podcasts recently that are talking about the adverse effects of not having that human connection and what that really is meaning for people who are already suffering, right? So if you're already feeling alone and now you're physically alone, how that plays a part in your mental health and your mental recovery is so important. Just someone myself, I live alone, and I'm constantly telling my teammates, it's great to be able to connect with them because it allows me to really feel like I'm communing, right? Even though they're physically not there, I know that I can text them, I can call them, I can FaceTime them. And so that's important. And also having the proper support, right, from actual professionals, that too plays a role. So I think that's key. I do want to kind of ask you, Erika, how has your organization been able to safely ensure that patients and clients continue to receive the same level? And I think you kind of spoke to this, right, in talking about your pivot to virtual and telehealth, while still ensuring that your team is meeting the need. Were there any specific sort of outcomes or items that even through Zoom that kind of sparked a new idea about ways that you guys could continue to engage?
Yeah, well, and I'll expand upon that a little more. Like I said, the need for these levels of services continue to grow. We from the start, wanted to ensure that our staff and our clients felt a level of comfort and safety as much as they could. So we started a COVID response team right away. It was very in response to the crisis, and now we've changed our name to the COVID maintenance team, and we're not sure where it's going to change next, but it's headed by our chief medical officer and our clinical quality director. And we also have various levels of staff members involved in this team where we're meeting regularly to make sure that we're continuing to meet the needs of our folks and our staff, right? One of the things we also did initially to pivot is we created an A and a B team for our frontline staff. So they rotate on a weekly basis so that we could decrease and limit exposures. You were talking about the awareness of social connectedness, and we know that it is super important in in recovery, in instilling hope for people. So we've had to really, outside of telehealth, figure out how to do frontline services. An example is we've had to adjust, how we serve in our opioid treatment program. We work with close to 600 individuals who need daily medication assisted treatment. That's 600 people coming in and out a door in a short amount of time.
Wow.
So we had to really alter, what this looks like for these folks.
Right.
We needed to mitigate risks. We had to adjust what service delivery looked like, stagger appointments, temp checks. We submitted exception requests for take homes. so that we could decrease the daily traffic, but we also really bumped up the telehealth to partner with that so that we had increased connections and touch points for folks. So they felt, although they were seeing us less physically, they were seeing us a lot more. Like they were joking, like, we're hearing from you guys all the time. So, and one of the other things we've done, like what we had found with virtual is like peer and some of our community support team that's a little more intensive, that's not necessarily going to meet the needs of some of our folks that are constantly in crisis. So we found spaces where we can meet with them and ensure social distancing, right? We are meeting with people in their yards. We call it like we're doing lawn work.
But lawn work. I love that.
But we've been trying to do surveys and just touch base with our clients to say, hey, what's working, what's not working, and also catch these things ahead of time, because we're working with an indigent, uninsured population that is typically hard to engage. And so, telehealth doesn't always work. So how can we still have these connections? And, putting a camping chair in a yard is one way. I know I'm talking a lot, but I wanted to throw in one other thing. One other thing that we've tried to do because of the population is create telehealth sites at our physical locations. So a lot of people don't have access to a phone. They don't have access to internet. So they can actually come on site to our organization, and they can receive those services on site and still do telehealth there. They can even do group there. So.
No, I think that's great. And I want to turn to Beth and really, kind of talk to that digital divide, right? Where people who may not have access to, a smartphone or some sort of tech device, but even also thinking about just community at large, right? We think, is it the device, or really is it a broader issue, right? And Beth, I know during our site visit, that was something that you really, really hit the nail on the head on about. It's like, this is bigger than just having a phone or a laptop, right? This is a bigger issue.
Right. And Johnston County, being that we're part of the county is so rural, I can give a family an iPad all day long or a phone all day long with minutes, but they don't have the access to internet at all. So even with the hotspot, it's been really tricky to help families get that technology that they need. School has been challenging for families. There's a couple of places within the county, the partnership is one of them, that we can set up some social distancing safe areas if a family needs to come in and use technology. Because again, that it's just that there's no technology to have. So there's no internet. And I think that through the pandemic, that's going to be one of the things that I hope the state will really address is the access to internet. And, I think one of the great things that has happened is people have learned how to use technology in a more positive way. Like our families have embraced it for the most part. And even though they were afraid at first, they're like, we don't even know how to click mute or any of these things. We have a large Hispanic population that we serve. And so we were able to kind of, you can put Zoom in different languages. So we were able to help figure that out for the families with them. And I think that moving forward, even when we can get together all the time and have our groups, have our play groups, have our events at the park, all those great, wonderful things that we know are so important to families, I do think that there'll still be a place for virtual for families that aren't maybe able to get out. If they have a child that's medically fragile, or if they don't have transportation, I do think that there's going to be a place for continued services virtually, which is positive. I think that's positive out of the whole mess of a global pandemic.
No, I think that's so poignant. It makes me think back to I think it was our second episode of Unwrapped, and Allyson, who is the director of My Kids Club in Johnston County. I'm sure you know her, Beth. She made such a poignant statement when she said, I can't worry about laptops with my kids because they don't even know how to use it. And so I have other issues beyond just the digital divide and the access to the internet. I've got to teach them, right? And so I think there's so many layers to this when we talk about sort of recovery and educating folks on what we can do and being innovative, that we've got to kind of get to the root of it, right? And it's causing a lot of people to kind of stop and say, wait a minute, there's some issues here, right? And we need to address those. And so, like you said, I hope that having conversations like these today across the state, even across our national communities, will really encourage folks to support organizations who do this work and really be advocates to make those changes. I do want to kind of ask you guys, what do you think is the greatest lesson you've learned during this global pandemic, both from your respective organizations, but also maybe even personally? What is something you've learned about your work that will kind of carry you throughout, even when this pandemic sort of not necessarily goes away, right? Because these things don't just go away, but when things return to some sort of normalcy.
It's there's been so much that I've gotten to learn, honestly. And I was just thinking when Erika was talking before about her clients that are in crisis, and you know, we think about early education and we think about, oh yay, family supports, family education, but the pandemic, kind of like a hurricane or some of the other like major crises, really brought it to light that families can't participate in all these amazing programs when their concrete needs aren't met. Yeah. So things like being able to provide diapers, which we think of maybe that's not such a huge deal, but if it means having food and lights versus diapers, like there's choices that families are making every single day, and that was way before the pandemic. Mm-hmm. So just to really address that poverty and the equity piece of it has really been coming to light too, because it's shining so brightly with the pandemic. We can see the inequities so clearly. Yeah. And it gives us an opportunity to really help solve some of these big social issues. And, it keeps me up at night sometimes because, again, I have no social life now that we have no pandemic, that we have a pandemic. So I'm kind of like, okay, what am I going to think about tonight? But really an opportunity to solve some of these really hard problems.
No, and Erika?
Yeah, I mean, I think Beth, you said it really beautifully. Like I think about at the beginning of all this, and all of us were, toilet paper or paper towels. Oh my God, yes. And then, being that person who doesn't have the ability to, be that first one in the door and buy in bulk, or I'm worried about, am I going to eat? Where am I going to sleep today? And then too, we can give you a mask. How do we help you to, keep the mask? How do you wash the mask? There's a lot of things like that. The other thing that I think has hit me throughout this is one, the impossible thing happens, right? Oops. So, anything can happen. Who knew? This year has been something. But just the way that people have kind of, I feel like, risen to the impossible, meaning like pouring their hearts in, being willing to go the extra mile, throwing out the most amazing ideas just so that these individuals that we, serve feel like they matter. Yeah. You know what I mean? Because they do. So I've been really humbled by working with just all of these folks in furthering our mission.
No, I think that's so great. I think, the pandemic has really, in a lot of ways, like to Beth's point, forced us to really think about the things that we sometimes put off, or sometimes the things that we put it in the back of our brain and we'll get to later, right? But now we've got all this time, and it's like, how can we really work to solve these issues and make the intentional changes, right, that we know these families and our communities need? But then also it allows the space for us to be innovative and be creative and really kind of throw a dart at the wall, see what sticks, right? I think a lot before people were hesitant to share things because they didn't know if it would work, right? But I always feel like the CEO of DocuSign, who now is worth, it's a $40 billion company, probably didn't think that his small idea would be so huge now, right? Or the leaders of Zoom probably didn't anticipate that they would become like the number one online platform that people could easily access. But they had an idea, they threw it out there, and it stuck. And I think that it allows for many of us in our spaces to kind of be creative, be innovative, share our ideas, see what works, and then really serve our communities in a great way. So the kind of the last question I want to ask you guys, which is a fun one, is what is one thing you love most about your work? I think that, you know, when you work in the nonprofit sector, you really are led by passion. So what is one thing that you guys really love the most about your work with your respective organizations?
You know, Allison, that's hard to only pick one thing, like, right? Because yeah, none of us do this work for the large paychecks. Like, that's not a thing. So it just, I think, you know, and I do have to shout out for my staff too. Like, I think watching them help families every single day is one of my favorite things that I get to do. And the passion and the resilience that my staff has shown through having to learn so many different things in such a short time. And then to see them still giving, you know, 1,000% to every family. It took 5 hours one day to find a specific kind of formula for a family because, you know, everything takes longer and again, shortages, but, you know, they didn't complain and they figured it out and really just rising to that occasion every single day.
Yeah.
So, right. If you would have asked me 6 months ago, I might have said, oh, I love seeing all my babies and all these people grow and all the children grow. Yay. But honest to God, it's really watching my staff just exhibit that amazing resilience.
Yeah,
Mhm.
absolutely. That's beautiful.
I think from our standpoint with community action is, well, it's twofold, I guess. Just actually being able to help even from probably within about 2 weeks to about 2 to 3 weeks after everything was shut down, we were able to flip. Our systems are web-based, and so we were still able to reach out to our participants, our clients. We were also able to deal with the vendors, and so to prevent disconnects and to prevent evictions, and then to I mean, just here, just to see. I mean, you know, it was, we couldn't see them physically, you know, but just to hear them and the relief and the sense of oh God, we're safe for another 30 days or whatever, because they weren't going to be evicted and they weren't going to be, services weren't going to be disconnected. And even though there were moratoriums, for those people who had been used to paying their bills, it still felt like it was wrong not to continue to do those things. And then for our staff, I mean, they just flipped over. This is next week now. October the 1st should be my 41st year with the agency. And this has truly been, it's been a time when you really, really get to see who is in it, who recognize that this is a mission, that this is nothing. If you came here to get rich, you should have kept on going. But it was that this is a mission, that our motto is helping people, changing lives. And to see that really, really, really kick in the high gear during this pandemic, that where the staff immediately, our ED, Mrs. E. Marie Watson, said, okay, how we're going to do this. This is what we're going to start doing, and just met with leadership staff. And immediately we got Chrome notebooks. We got them before they disappeared off the shelves and stuff. So we got those for the staff. We got them cell phones so that they could still reach out to their clients. And so they were able to, and even addressing when we talked a while ago about those that don't have access to computers or whatever. But on our website, we put the applications there so they can actually do them. But for those that did not have that access, all they had to do is they called, and when they called and got our voicemail, it instructed them what to do, what they would need, and that we actually, by phone, keyed in and did the applications with them just talking, answering the questions. And so they did not have to come to us. They didn't have to try to utilize somebody's internet or whatever, or computer, because we actually did it on the phone. So Spectrum came through on their landlines, and so we were still able to impact lives, and we had gift cards, and so we were actually able to distribute those gift cards so they can buy the supplies, the food and the different supplies that they needed. It was just so many things, and it was heartwarming to see how the staff just jumped in. And of course, all my staff is younger than I am, and so they were, a lot of them was already tech savvy, but those that weren't became tech savvy before it was over with, and the staff helped coach them through that. The other staff helped coach them. So I think the teamwork and understanding that they had, that they really, really, really believed in the promise of community action. And our, like I said, our whole mantra is helping people, changing lives. And
Thank you so much for that, Tina. I think it is awesome to hear about when organizations are able to pivot and really still be able to serve their communities in need and really live into their missions. So I really thank you for sharing that with us. Erika, what do you think is the greatest lesson you've learned during this global pandemic from an organizational perspective, as well as personal?
Oh, yeah. That's a big question. I agree. I think, personally, I've always really been passionate about sitting with someone in their pain, right? Or just being present with them. And this kind of thought of I'll sit with you with this, right? And I think I've really had an opportunity to help to develop and work through other leaders so that we can really further that mission of, your life matters. You're important, right? Keep going. Recovery is a journey, right? Mental health, substance use. And this is just, I feel like, personally helped me to prioritize what matters most in life versus we can get so caught up with the day-to-day and the things that are maybe less significant. So for me personally, that's been huge. It's also lesson learned. I'm not a great teacher. I learned that because I have 3 kids at home right now. So that's a personal lesson learned.
No, I think that's very relatable for a lot of folks on our call and out there, right? We value our teachers. We want them to know that.
Yes. Oh my gosh. Absolutely. But in general for the organization too, just like the fatigue, the COVID fatigue, it keeps popping up at random, and it's a lot for people. For our clients are getting tired of it. We're all getting tired of it, but it's not quite tired of us yet. So, that's been just something that's become relevant for me.
Awesome. Well, thank you both so much for that. And I truly have found this conversation to just be really, really kind of nourishing and really creating perspective for folks to understand that, COVID-19, while in the beginning we were all responding and trying to do what was best, we are now shifting our kind of focus and lens to really find out how can we continue to be intentional with our new norm. And so I want to give you all the opportunity to kind of tell people how can they get involved and continue to support you and your organization right now. What are the things that they can do to ensure that both Partnership for Children of Johnston County and Southlight and folks out there are able to meet the needs today?
So for the Partnership for Children, because we are a 501c3, we're always needing that financial support. We do get some state funding, but we have a mandated match that we need to make throughout community donations. So that's always helpful. A concrete support that families need right this second still are diapers and wipes. So you can feel free to drop off diapers and wipes any size, because that's an item that's so critical for kids 0 to 5, and it's not covered under food assistance or any type of community government assistance. You can't get diapers necessarily with with SNAP benefits or obviously without SNAP benefits, but that's something that families, it's a real health need as well. We want all the babies in Johnston County to have clean heinies and feel good, right? That's the thing. So that's always welcome. And, just continue to support us on our social media and keep an eye out for what we need for families.
Awesome. Erika?
Yeah. So, well, one thing I wanted to say is something that Southlight has done is we have provided a free online session that we can offer for organizations if they want. It's called Paving a Path Forward, and it's helping organizations to navigate trauma. So it kind of touches on COVID, it touches on mindfulness, trauma, how it manifests. And it's something that we are offering for staff, for volunteers. And so, we would be happy to do that. So I want to throw that out. And the other thing, again, like Beth says, is, we're open, right? We're a resource in the community. We're serving folks, and resources are limited right now. Some of the community organizations that had things, they don't. And so helping people to meet their basic needs. So like donating food, supplies, personal protective equipment, help us to move our mission. Donating makes a difference.
No, I love the way you said that, helping us to move our mission, right? That's what it's about. It is the mission and the values that you all live into day in, day out with your work, as we see with all of our funded partners, and being able to move the mission forward, moving that needle. I think that is so key and crucial, and ever more important during a global pandemic like COVID-19, right? I want to take the opportunity, if we have any questions, to use this time for our audience. If you have a question for either Beth or Erika, to please drop it in the chat, and I'll give folks a few seconds if you have one to do so. And while folks are dropping questions, I want to let people know how they can get involved with your organization. So please check out Partnership for Children at their website. Look at those beautiful faces, www.partnershipforchildren.org. As well, please check out Southlight, all right, in Wake County, not Johnston County, at their website as well. Let's see if we have any questions here in the chat. It appears we do not. But again, I do want to take the opportunity to thank both Beth Moore and Erika Carey for taking the time just to chat with us today and really bridge awareness on how the COVID-19 pandemic is impacting your respective organizations, how you're continuing to pivot while being creative and innovative in meeting those needs that are there in the community. Thank you so much for being here, Beth.
Thank you, Allyson. And I really want to thank the United Way. Y'all have been amazing for a long, long time, but right when that pandemic happened and we were able to kind of just get some help from the United Way, those concrete supports, and how supportive you all have been through this whole process. So I really, really want to thank you and everybody at the United Way, because we really can't do what we do without the help and funding that y'all help us with. So thank you.
Yeah, thank you so much. We appreciate being here and that you thought of us. So thank you.
No, this is why we're here, right? This is the work that matters. And to us as an organization, it is both important to highlight the individuals who do this work day in and day out to the community, but also to create that awareness. And so for us, it is nothing but a fortune to really to know you all and be a part of your organizations and really to serve as advocates for you in the community. And so to our guests and our audience here, please check out both Partnership for Children of Johnston County and Southlight Innovative and Behavioral Health of Wake County, two awesome organizations who are doing the work to ensure that folks in our communities are being served each and every day. Thank you to everyone. Continue to check out the United Way triangle.org. We will have an upcoming episode with TROSA. So we're excited to highlight the work that they do. And remember that these are free. So tell all your folks, come check us out. But again, thank you to everyone. Continue to have a great Friday and be safe.